we discussed that topic and you know about that, you will see that those indices are to be calculated. For that, one relevant hematological experiment is to be done in the lab. Now, after getting the question, you have to decide which experiment. It will be not told directly that estimate hemoglobin and produce your result. Like one question already I have discussed yesterday in the theoretical class also, if oxygen carrying capacity is to be calculated, then you have to know that 1 gram of hemoglobin carries 1.34 milliliter of oxygen, and you have to perform the hemoglobin experiment and then calculate like that. This so many grams into 1.34 per 100 milliliter of blood. So much of oxygen is carried plus so much milliliter of oxygen is carried per 100 ml of blood or per deciliter of blood. So this is the format for the hematologic examination. Those who did not attend on Saturday, study the topic and come with the books. You will just attend according to the roll numbers from next week. So from tomorrow. So from tomorrow onwards we will be doing that. So those who, if someone is there who is in batch C right now sitting over here, but will be batch A or batch B if tomorrow onwards, so attend according to that, and before coming study the topic and be with your books. We will try to divide from tomorrow itself here in the lab the groups according to the roll numbers. Every group should have at least one book, but it is better to have your own books because everybody is not following the same textbook. So it will be easier for you if you come with that textbook which you are reading regularly, that practical textbook. So bring that book, because if you have not attended the class and know nothing about the topic, you can't perform. It is not possible to perform here. Most topics, but this has some theoretical aspects to it. This particular topic, total count of WBC, total count of total leukocyte count, which is written as RBC in your syllabus, RBC and TLC, total leukocyte count. So these two topics you have to know about. The Nauber's chamber, there is a calculation part, how to determine the dilution factor, the concept of this dilution factor and all. So if you don't know anything about the topic, just come to the class and start pricking blood, then you can do nothing. DLC was still simple, that after you load over the microscope, it is a lengthy experiment, but after you take the blood on the slide, draw the smear. So more of hands-on, draw the smear, just know a bit of theory, then see under the microscope. Gradually you can find the cells and count the cells. But here some theoretical aspects, some concepts have to be developed before you go on to perform the topic. So if you have not attended the class on Saturday, even if you have attended, you have to read and come, because you have to keep the concept in your mind. You have to refer to the books. But if you have not, then please give at least 2 hours behind this topic and study the topic, understand the topic, and then attend the class. And if you don't perform hands-on, no topic is, you will know, even the simplest one, if it is the determination of blood groups, you will make mistakes if you do not do hands-on at least once or twice. Even the simplest of whatever you have to perform hands-on, blood group, BTCT, these are pretty simple, but still if you have not performed, you will make mistake at one step you have not done at least once. As you go on practicing, it will help you further, but if you do not do at least once, then you are going to face problems in the exam. And just see, most of the candidates or students from your just immediate senior batch of 2024-25, most have failed probably due to that means failing or getting inadequate marks in the theoretical part, because that we'll discuss again, that why, because either students are not attempting questions, multiple questions, so leaving blank answer sheets won't help students, that we go on telling, or writing completely irrelevant things. So that is one cause, but some students were lagging in the practical part also. Many students, even after our repeated instructions in the practical part, if you do not practice clinics at your home or hostel, whatever, if you do not practice hematology, we try to arrange at least some revision classes, although time is very short. Like today's is a revision class. I think all of you have attended once those classes. 2 classes were there on arterial pulse, 1 on blood pressure. I think you have attended. Today we will practice this among yourselves, pulse and blood pressure. There are 4 sphygmomanometers over here supplied by the institution for you, and as many number of stethoscopes. I would again suggest you simple things like stethoscope, at least 1 stethoscope, 1 say measuring tape, 1 torch. These simple things you keep your own personal. This is not a compulsion, but this is my suggestion, because during the exam, suppose you are asked to do one very simple, there are clinical examinations with the torch. Now you don't have a torch right then, and the torch which is from the institution, somebody else is using it. What will happen? Examiner won't waste time. Examiner will go, okay, that is not available now, so he or she will pass on to another question which may be tougher. So please keep these simple things with you. 1 stethoscope you will need right from the next year onwards, you will need it, actually need it. Although you may say that that means I have come here as a medical student, I have paid the institution, that is also to be supplied. Yes, it will be, but not as many number of students. For 150 students, there won't be 150. So I would suggest have those things on your own, even if not the sphygmomanometer. If you have a sphygmomanometer also, it is obviously better. You can practice these types, not the ones running on the battery. So those are for laymen. Those are just tying and noting the result. So not this. Either the mercury one, which is not, I think, don't know. I actually don't know whether these are available in the market anymore or not, because once they broke away spillage of mercury and all these problems. So whatever you find here, if you have 1 sphygmomanometer of your own like that, it is nothing better than that. But even if not the sphygmomanometer, at least this torch, measuring tape, stethoscope, a watch, obviously you already know, due to note the pulse, watch. Mobiles, calculators are not allowed in the examination hall. So pulse, I think examination of the arterial pulse already you know, but I'll just recall the salient points for you. The rate only is not enough. So students are just reporting after counting the pulse. What is your report, sir or madam? 70 in the exam. The external examiners, so 70. So the examiners are going on repeating. Do you want to add anything? No, 70, 80, 90. So firstly, even this is the rate of the pulse, and even this number, just uttering the number is an incomplete answer. The answer is beats per minute. 90, 80, 85, 84, 87, whatever it's beats per minute, and rate is not enough. It was the idea, concept of the pulse which you have as a before being a medical student is the rate of the pulse, but you have to speak about the rhythm, whether it is regular or irregular. Again, irregular can be regularly irregular and irregularly irregular. We have spoken of this. Read the book. What are these? Irregular means no particular, that means no pattern at all in the irregularity. But even if irregularity, if that is a regular pattern, like 3 beats 1 missed, or 4 beats 1 missed, again 4 1 missed, or 5 2 missed, again 5 2 missed. If there is a pattern in the irregularity, it is called regularly irregular. Otherwise, it is regular. So read the rate, rhythm, volume, high volume or normal volume or low volume, normal volume. The feeling of the normal volume comes by experience. So the first year of medical school, probably your own colleagues are your subjects most of the times. So we are practicing these clinical topics on healthy subjects and noting the normal results so that you can compare them when you go to the wards. Very few clinical classes may be done in the first year, but from the second year means second phase onwards. Now it is called phases. Second phase onwards, you will go over there. So the clinical classes, when they will start, you can compare with the normal findings if you get abnormal findings. So the purpose of the first year, and you are not expected to know about any abnormal findings right now. Maybe theoretically some, but not very much. In the first year of medical school, the examiners will also concentrate on during your examination, during this first phase examination, that whether you are doing the procedure correctly. That gives you enough credit at least to pass. Results, your findings sometimes may be incorrect also, but if findings are not that important, at least in the first year, but the procedure is important. If you are not properly exposing, maybe if your own colleagues, own friends, own batchmates are the subjects, then at least you don't have to expose for privacy reasons totally, but you have to tell the examiner that I should expose. Now, if the examiner then will be considering, okay, you don't need to expose, do it over the shirt. But if you don't tell that, don't utter that, then the examiner will consider that you don't know that proper exposure is needed for clinical examination. So, these things have to be followed. Now, in some cases, exposure is not inconvenient, it is convenient. Like during pulse, you have to semiflex and semipronate. I think you know about what is flexion, what is pronation, what is supination by now. These things should be familiar by now, even if you have joined late. So, what is the anatomical position, what is these different simple movements of the joints, flexion, that is bringing the two sides of a joint, that means in case of the elbow joint, say the arm and the forearm towards each other. This is flexion. The opposite is extension. What is the flexion as the wrist joint? The flexion at the wrist joint is not as, that means the flexion of the elbow joint is possible up to say even 5, 10 degrees, 15 degrees, but flexion of the wrist joint is not possible up to that much. So, semiflexion is not exactly half obviously, but nothing is so mathematically that accurate in medical science. Nothing can be 2 plus 2 4, but it is semiflexion means a part of the flexion. Semipronation means, supination means when you are lying down on your dorsum, the dorsal surface, when it is on the horizontal surface, ventral surface facing up, that supine position, the opposite is prone position. The ventral surface is lying over a horizontal surface, say a clinical the beds, and the dorsal surface faces upwards. So, in case if someone is sitting or someone is standing and even asked to pronate, that means from this in the anatomical position, this will correspond to supination and this is pronation. So, semiflex, semipronation, and finding the styloid process for noting the radial pulse, and then noting the rate, breathing, volume. Go through your books, condition of arterial wall, how to do it, and delay or equality. And in case of blood pressure, palpatory and auscultatory method, both. Will not spend much more time over here. You just go today, still not according to roll numbers, you just randomly divide among yourselves, and if you have your own sphygmomanometers are all, carry it and bring that back, don't forget. Here 4 are supplied, so some will be making a group and performing this pulse, others will be doing blood pressure, and then reverse the order, and all of you practice during this session. But I repeat, I go on repeating that 1 hour sessions, 2 hour sessions, and then not practicing it even single once or twice before the exam, not just before the exam, all through the year you will forget and make mistakes. So, at the homes or hostels, whatever is possible, that is why I suggest you keep your own this apparatus as much as possible. Now, you can't keep microscopes, that is practically not very feasible, but whatever is possible, simple things you keep with you and go on practicing, because 1-2 hour sessions for one particular topic, maybe 1-2 revision classes, this won't be enough when you perform hands-on. Performing hands-on and knowing that just the theory are completely separate things. Just knowing the theory doesn't make good doctors, even average doctors. It will be below average if you don't know how to perform hands-on. As pathologists, you have to perform the same hematology things, although these days there are automated machines, but DLC particularly still done in laboratories like this. There are small scale laboratories where a lot of machines are not available due to cost issues and all. So, you have to perform the same things if you become pathologists. So you become an MBBS, then you go for a course in pathology, MD course, higher course in pathology, become pathologist. You have to perform these things, and this will fetch your bread and butter for all your life. So don't neglect these things. More than theory, these are important. Obviously, theories are important. Why I am doing this, what are the concepts behind this, otherwise there will be no difference between a doctor and a technician. A technical person, there will be no difference. Just they know, suppose somebody knows, you will learn it in maybe physiology classes and thereafter also, how to perform an ECG. But if you know only how to perform an ECG, just put the leads over the chest, of you have not seen till now, you have just discussed the theory. So if you perform, that is, if you can perform, that's okay, but that's just a part of your what you are supposed to know, because you are not technicians, you will be doctors. So you have to know the theory as well. But if you can't perform certain things, clinical examination, it will be absolutely disastrous. Clinically, you have to note many things which will help you arrive at your diagnosis. So right from the start, earlier days were there when even without knowing how to measure blood pressure properly, people were passing, but the medical commission has become very strict. These are not allowed. Simple vitals, which I call vitals, pulse, blood pressure, noting the respiratory rate and temperature can save a life. If it cannot, just noting these things cannot cure a very complex disease, but it can at least save a life at a very critical moment. If I just know how to note this properly and take actions accordingly. Pulse, blood pressure, respiratory rate, temperature. So without knowing these things, these basic things properly, one is not eligible to pass. No examiner now would allow these things. That you can't measure blood pressure, you can't measure pulse, report a pulse examination of the arterial pulse properly. Maybe you don't examine all pulses. Actually, examination of arterial pulse, if it is to be done in detail, it has to be measured all the peripheral pulses. You don't know still about all the peripheral pulses in the infrared extremity. We'll read about this when in the anatomy also, that what are the arteries present where and what are the pulses. Start with the radial pulse, you will go on knowing. I am not asking you to do the carotid pulse also right now. If you measure, estimate the carotid pulse, one very important precaution is both carotid pulses together, no, never. It will compromise blood circulation to the brain. So it has to be done. So delay, equality we find, but never for measuring, estimating equality, delay, what we do, we can keep our hands on both radial pulses simultaneously with the clinician's two hands, or one on the radial, one on the femoral, and estimate radio-femoral delay, but never two carotid pulses together. So at least in the beginning, we are not asking you to do carotid pulse and all. At least the radial pulse, in the initial days, you learn it. The procedure should be correct. In the first internal examination, we will concentrate only on this. If you can show the report the radial pulse correctly, that will be sufficient. We expect that. Then by the end of this phase, at least the peripheral pulses like this, radio-femoral delay and all, also the carotid pulse, but that is a precaution to be remembered. Not if you, for everything should be done bilaterally, even the carotid pulse, but in case of carotid pulse, not simultaneously. In case of pallor, you see both eyes together. Jaundice, you note, you see both eyes together, but not both the carotid pulses together. So these things, as you go on, it will just shape up in your mind. But so practice, as the more you will practice, the more you will get acquainted with it, and more you can perform better. That is history taking, part of history taking. For today's class, we are concentrating on pulse and blood pressure. You may do general physical examination as well, but we are concentrating today on pulse and blood pressure. Practice. History taking and general physical examination has already been done. Maybe we will revise another day. So height, weight are not required as of now. You just, if you want to practice, you can practice general physical examination as well. You are getting time, don't waste time. Take it as a class on revision topics on general physiology. if possible, take off your this upper this at least these sweatshirts and all, if possible, because the more you put, what is the theory behind this? More you put clothings are there, will it be a higher result or lower? That means higher value for the blood pressure or lower value? Falsely higher or lower? It will be different than the actual value. Actual value is direct measurement. Direct is putting the cannula inside the artery and connecting into the manometer, but that is not practical. So we do the indirect measurement, that is tying the cuff over the skin. Even this sphygmomanometer has to overcome the pressure of the skin and subcutaneous tissue and all. So it is higher, somewhat higher than the actual blood pressure, and if you go on putting something over that, it will go on becoming higher. So as much as practicable, you should avoid these more and more these coverings over the skin and subcutaneous tissue. That is in indirect measurement, skin and subcutaneous tissue will be there, but as much as practical, clothings are to be, that means proper exposure is one of the criteria of clinical examination. Here you at least, if it is possible, remove the sweatshirts and all and then practice. Okay. With the stethoscope? No, at least it should not depend on these sphygmomanometers. These are pretty new ones. These are just received by the department. You have to practice and listen for the disappearance of the sounds. Just practice. Appearance of the sound, disappearance of the sound. Actually, the ambient should be as quiet as possible, which is not over here. So you have to note that. Still, it is possible to hear, but you have to note that the ambient should be better, which is not practically possible in this scenario. Why are you making a fist? If you remember that your subject is probably a layman when you have become professionals. So if she is making a fist, so if fist is not required, then you as a clinician have to tell that this is not required. There is no requirement to make a fist during measurement of blood pressure. So whatever you suggest, you instruct the subject properly and do your examination. Just say, I am going to examine you, please cooperate with me. If you have any issue, then report, then tell me during the examination. There will be certain clinical examinations. Between the examination, making sounds are not allowed. That will be informed to you, but for now, just say that cooperate with me if you find any problem. But if there is any problem, then tell me that. Just communicate like this. No need to tell I will measure now. No need to tell measure pallor right now, because the subject probably does not understand what pallor is. Blood pressure, pulse, maybe even a layman understands, but pallor, cyanosis, these terms they don't understand. Don't say I will go for your cyanosis examination. Just say I will go for a clinical examination. Just cooperate with me. Like this. Communication is also has to be proper. During the examination, as much as possible, try to talk in English. Examiners will be from outside. And again, 71 is what? What 71? Beats per minute. That is pulse. Again, practice telling that 71 beats per minute.
Pulse beat was 71 per minute. And the pressure was high. Pressure in the volume was high. And
pressure, there is nothing called pressure. Rate, rhythm, volume.
Okay, so the volume was high. I can feel the pulse properly. Then the pattern was regular, and there is no radio-radial delay and no pulse delay.
So what did you do for radio-radial delay?
So radio-radial delay, I measured the both pulse.
Both radial pulses simultaneously.
Yes. And for the pulse deficit, I measure one. I take the right hand and use stethoscope for the heart.
Right. So this can be done even if not the heart rate and the pulse together, it is good, but at least the delay or equality. So at least measure, as beginners, measure both the radial pulses separately and note whether the rate, rhythm and volume is similar in both cases.
And sir, at last I checked, is there any atherosclerosis or not?
That is how to measure the condition of the arterial wall. How to do that?
I hold the hand and using 3 fingers, I block the pulse.
All the fingers are not used to block the pulse.
2 fingers I use.
The index finger and the ring finger, so which is the middle finger are not used to block. This is not called block the pulse. You will
check is there any compression or not?
The term should be whichever is proximal to the middle finger, that finger blocks the blood flow. Then another finger which is distal to the middle finger, just prevents, that is also pressed, that just prevents any little black flow or whatever they may be there, any little. So that, and the middle finger rolls over the artery. So during measurement during estimating whether the condition of the arterial wall, the blood flow won't be present in that particular artery at that moment. So during measuring rate, rhythm, volume, if you don't practice, what mistakes can be there in the exam, you just know about the theory. Condition of the arterial wall can't be measured simultaneously along with the pulse, rate, rhythm, volume, because the criteria for measuring condition of the arterial wall is there should be no blood flow. I just want to see whether the artery is thickened. So that has to be done separately from that 1 minute for which you measure the pulse. Okay, now let her do, and then you also see what result you get. You will come to know about in your course of this first phase. So probably the examiner will be saying no. Most of the times there is not much time to conduct the exam, because your clinical examination, if it is of 20 marks or say 30 marks, it will not be only one topic, pulse. It will spread across so many topics. General physical examination and the systemic examination, which has not been started in the classes still now. So all those things. So probably it will be only about the radial pulse. But if the examiner asks you to, or the examiner, okay, you show, then you have to show. For now, radial pulse, both hands radial pulse. Yes, in each clinical examination, you have to take the consent and all these things, communicate. So in this case, if it is only about the pulse or any other clinical examination, I am going to examine you, please cooperate with me. That should be the in most cases, this will be the necessary communication. In some cases, some clinical examinations, some particular things are to be explained for that. So we'll go on discussing that as the classes go on. For pulse, say I am going to measure your arterial pulse, I am going to measure your pulse rate. The subject is probably a layman, so you say pulse rate, I am going to measure your pulse rate. Actually, you see rate, rhythm, volume, everything. But no point in saying medical terms to your subject. I am going to measure your pulse rate, please cooperate with me. I am going to measure your blood pressure, please cooperate with me. If you find any problem, then tell me that, then utter that. In case of pallor cyanosis, pulse and blood pressure is still okay. In case of pallor cyanosis, then physical examination, you don't need to utter, I am going to measure cyanosis, I am going to measure pallor. The subject does not know those terms. So you just say, I am going to examine you, I am going to examine your eyes, I am going to examine, just put out your tongue for me. Just go on communicating as you should become very frankly, you should communicate. Just put out your tongue. Do you have any problem? Just go on conversing with the patient as, that is the subject, sorry. What is the difference between the subject and the patient? Till any actually a ailment is diagnosed, we probably call the individual, it will be better to call the individual a subject, not a patient. So just go on conversing with the individual, make him or her comfortable and go on examining. So proper communication is just this is a skill which is not only for the medical field. Yes, when you are measuring female subject, obviously that is one of the criteria for physical examination. There should be a female attendant, and absolutely exposure should be as per the criteria to be fulfilled for the clinical examination. Ideally, the exposure, we'll be discussing the respiratory system examination of CVS and all. For examination of the respiratory system, from this part, from the neck to up to the upper part of the thighs, the exposure is same for the male and female. In case of the female person, there will be a female attendant, obviously. during the exam, see, at least in the first phase of your exam, probably your colleagues will be your subjects, so these privacy issues and all those will be taken care of. You don't need to worry about that. The examiner will himself or herself tell you do it over the clothings and all. But when you go to the wards, when you appear for the medicine exam and all, there will be these arrangements for that. For the candidates, if they are to examine a male subject, so proper precautions, this should not be called precautions, the criteria will be maintained obviously. When you become a professional, if it is your own clinic, you have to arrange for that. If you are working for an institution, a hospital, then the hospital will arrange for those things. If you have your own clinic, you have to arrange for that. Your own clinic, you yourself is the only doctor over there, so you have to keep a female attendant, and these things are becoming very, very strict nowadays. So this you maintaining the clinics and all, what criteria are to be maintained, these are very strict nowadays. Over the past, say, 1 decade, 2 decade, so there are vigilances over these things. Yes, medical legal things which you will which about these things you will study in forensic medicine. Okay. The rhythm is irregular. Have you found in him? Note it again, let the others note. I don't think if does he have any cardiovascular ailment known? Rhythm irregular during pulse examination. I won't say always a very grave thing, but at least there should be causes for it. So do it again. If you find, you can report, but probably all of us here are mostly healthy persons, irregular pulse rate won't be there. So as you go on practicing, those mistakes will be, and we, as I told you, in the first year of medical school, we usually don't give much emphasis on these findings. We emphasize on the procedure. If you find, you can say, obviously it is theoretically possible. So probably the examiner will cross them. The examiner, if he say during the examination, if he is the subject and you are examining them and you say irregular pulse, but it is somehow not expected according to his clinical whatever scenario is there, so the examiner may cross, examiner may himself check or herself check the pulse, and if you are wrong, then you are wrong, if you are right, then you are right. It will disappear at one point, note that point, go 20, 30, 20 above say, and then again deflate slowly. So probably in most cases at that point pulse will again reappear, that is the systolic pressure. After that you deflate fast, you may deflate fast. So that is the systolic pressure. Now you know the systolic pressure in the auscultatory method, go 20 or 30 above that during deflating, above that value. If it is 110, then go up to 140. Sometimes in the auscultatory method, during again when you hear the sounds, it is systolic. So note that as systolic, but it may be higher than the systolic pressure which you noted during the palpatory method. Did you understand the palpatory method? Just show me, sit, you sit. Suppose, just imagine a BP cuff is tied and you are inflating it with this hand. So where should your left hand be? And after, you should instruct properly semiflexion, semipronation. You do it yourself, see. Again, she is making the fist. I don't know why it is become a habit for you. No fist is needed. Semiflexion and semipronation. Now, when you are deflating, you are inflating with this hand. You know your eyes will be over there, and you have to concentrate on when the radial pulse is going away. That value has to be noted. You go 20 above that during this palpatory method. Come down. Probably at that point pulse will reappear, that particular, say it is 110, 106, whatever. So it reappears, then deflate fast, that is probably 106 is the systolic pressure, but sometimes the auscultatory, in the auscultation method the systolic will be somewhat above that. If it is 106, then go say up to 120, 30, you inflate up to that, and then again come down, the sounds will appear, if not at 106, maybe 120 or something, 116. 112, and then when the diastolic pressure is not possible by palpatory method, it will be auscultatory. When the sounds disappear, it is the diastolic one. Theoretically, muffling and disappearance, several authors are writing like this. Some authors are writing muffling is the diastolic pressure, disappearance, they are not writing disappearance. So even some authors in the book by Dr. Ghai, you will see mentioned, I think in the, at least in the previous edition it was there, that pulse is, blood pressure is reported as say 116 by 84 by 78. So 84 is the point of muffling, 78, but don't go for such complications at least in your first year. You take disappearance, okay. It will be better for you as beginners. 116, that means in this case 116 by 78. So it can be written as 116 by 84 by 78. That means 84 is the point where the sounds become muffled. That is typically that you have to learn. What is muffling sound? That will be experienced. That just before disappearance is there is the character of the sound, that is called muffling. The sounds are gradually become, it is drying up. Just before disappearance, there is the sounds appears. That sound is called muffling. Okay, the lab technician madam is not supposed to teach you clinical topics anyway. So that is possible, but I won't suggest these to go deeper into these complications as beginners. Note sounds and report. Yes, between 7 to 20 there are other markings. Now, blood pressure, can it be, say, theoretically, can it be, say, 109 by 75? Is it possible or no? Why do you think no? You have to give reasons in support of your answer. I am saying, is it possible, say, for 109 by 75, is it possible or no? Yes or no? Yes, is it possible? Any, but see the graduations are the larger graduations are at in multiples of 10, and in between there are multiples of 2. So see that it may be 112 by 76, but in using this instrument, don't report it as an odd number. Obviously, theoretically it can be an odd number. It is, most probably it is in many cases, but odd graduations are not over there. So you report it using this instrument as even numbers. So if it is between, say, 112 or 114, even if it is possible to note, say it is 114 or 112, don't say 113, because that is graduation is not over there.
There are 5 graduations in between.
Yes, 5 into each the small graduations are at separation of 2. The larger ones are multiples of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No, in this case there are 10 graduations between 1. You can even report odd figures. Okay.
So in between 70 to 80.
Usually there were instruments, see in between, just let me see 1 second. No, sorry. Between 60 and 80, there are 10 graduations. That means there are multiples of 2. Yes. In between 70 and 85, that means each counts for 2.
It was somewhere between 70 to 80.
So just try to note that somewhere also, if it is 74 or 76. But never say this with this instrument, don't say 75, as that graduation is not present. 73 is not present. 119 is not present. 123 is not present. Either 122 or 124. Okay. So even figures you should tell. Now practice palpatory as well as auscultatory. So now how to see pallor in that part. Okay. So first ask him to look up. So please look up. Now you have to see both eyes. So what is the point in this is also a part of the examination. What is the point in noting at different times twice? So do it simultaneously like this. Just look up. So this part. What is that part of the eye called? That is conjunctiva. That is the lower conjunctiva. It is called the lower palpebral conjunctiva. The upper part is called, just look down. Look downwards, not putting the head down. Again, we have to explain this to the layman. Don't put your head down, just look down with your eyes like this. Yes.
Eyeball down.
Yes. This is the noting the upper bulbar conjunctiva. This is for jaundice. So when you become professionals, don't go like this, that I will now note pallor. Now again come back to the eyes after 30 seconds and again note jaundice. Whenever you note the eyes, note everything in the eyes. But in the exam, there may be a question, note for pallor. If the examiner tells you that, then you see the lower palpebral conjunctiva, just protrude the tongue So you see the whole of the tongue, whether it is reddish or pale, and also tip of the tongue we note for cyanosis. Just revert it, just protrude the tongue and then revert it. Now take the tongue and revert it. Don't close the mouth. Yes. Revert it means that. Yes. Under surface of the tongue is for noting jaundice. Nail beds, just put up your hands like this. You have to show that put out your hands like this. The layman won't understand what to do. So you have to show. Now note for the nail beds. Put your palm like this. Note for the redness or paleness. This is noting for pallor. Likewise cyanosis, tip of the tongue. Okay, the lips. Then the again not the nail beds but the peripheral, this tip of the nails. Okay. So if you want to hold, then take permission means that I'll hold your hand and do it gently. Okay. During clubbing you have to hold the hands and see. So don't just, you are just going and as if thinking this is your friend, but just practice as you are supposed to do. He or she will take her own spectacle, his or her own spectacles off. Don't just pull it and grab it. So those are also to be practiced. Practice these things at home. How to better communicate. Okay, whatever you are doing, you may proceed. Thank you. White skin. So whatever is that is normal. Paleness of the skin. Why is there any abnormal streak?
white spot as well.
No, nothing. These are almost normal. If you can consult any skin specialist or not, but these things you see your own nails. That is not paleness.
So, doubt.
Yes.
পালস ডেফিসিট চেক করার সময় মানে এই যেটা সিনক্রোনাইজ হবে রেডিয়াল পালসের সাথে, এটা কি অলমোস্ট একসাথেই হবে না একটু ডিলে হবে?
Radial pulse with what?
With pulse deficit with the heart
Deficit. The meaning of the word deficit is that you are what you are noting for.
হ্যাঁ, বাট ডেফিসিটটা কতটা হবে মানে যে
that has no that has not any particular value. In our cases, maybe we'll get it together. There will be no deficit, at least here. But when you note, you have to note that only, that how much time has elapsed before the heart rate, and that is depending on the obstruction only. If there is obstruction, if there is a large obstruction, usually you will read later about the coarctation of the aorta. What is the common site? Coarctation of the aorta, the common site is, even I just can't remember at this point of time, the most common site. Like that, the blood does not flow properly to the left hand, but it flows towards the left limb. That means after that division has occurred. That is the site is, what are the branches of the, okay, you have not studied till now. What are the branches of the aorta? Direct branches. So it will depend where the obstruction is. If the obstruction is in the upper limb or just prior to the upper limb coarctation of aorta, usual finding is delay in the upper limb pulses, left upper limb pulses. The divisions on both the sides, you will know it in anatomy. I just can recall at this moment that the direct branches of the aorta. So there is difference in the left hand and the left side and the right side. When you read the thorax and the abdomen, then you will come to know of these branches, and by after 2 or 3 months you will know better than me, because I am not reading anatomy for a lot of days.
Sir, pulse মাপার জন্য আমি যে কি নামগুলো ইউজ করি,
Yes.
তো এটা তো হলো ব্লক করার জন্য এটা রিডিং, আর এটা হলো আলনার
Why block? That is during measuring the estimating condition of the arterial wall. But otherwise, don't use the and don't tell the word block. Tell obliteration of blood flow during estimating condition of the arterial wall. Possible atherosclerosis. So,
স্যার এই থার্ড নাম্বার ফিঙ্গারটা যা আমি শুনেছি এটা স্টপস ইন্টারফারেন্স ফ্রম আলনার আর্টারি, তাহলে ওটা মানে ইন্টারফারেন্সটা হয় কেন?
ulnar artery. During measurement of radial pulse, why do we call of the ulnar artery? At least during measurement of radial pulse, there is no, there should not be any mention of the ulnar artery. And don't utter these terms in the during the exam. Sunechi, whatever you have to defend yourself, you have to defend with answers from standard textbooks. So follow the class. Ulnar artery কোনো কথা এখানে নেই যেখানে রেডিয়াল পালসের থাকে।
আমার ফিঙ্গারের টাচটা কি হবে?
ডিউরিং কন্ডিশন অফ দ্য আর্টেরিয়াল ওয়াল দেখার সময় কোনো পসিবল ব্ল্যাক ফ্লো বা কিছু হচ্ছে, কারণ আমি একদিকেরটা বন্ধ করে দিয়েছি ইন্ডেক্স ফিঙ্গার দিয়ে, এভাবে যদি রেখে থাকি এটা দিয়ে বন্ধ করেছি, সেইটা বন্ধ করার জন্য যাতে আমার মিডল ফিঙ্গারটা রোল করে কন্ডিশন অফ দ্য আর্টেরিয়াল ওয়ালটা বুঝতে পারি, সেই সময় কোনো ব্লাড ওখান দিয়ে চলাচল একদমই করছে না সেটা ইনসিওর করা যায়। দ্যাট ইজ টোটাল অবলিটারেশন অফ দ্য ব্লাড ফ্লো টু দ্য আর্টারি। কিন্তু রেডিয়াল পালস দেখার সময় আলনার আর্টারির কোনো কথা নেই। Just know from your anatomy teachers radial artery location কোথায়, ulnar artery location. You have to write the course in the exam, the first phase exam only, মানে maybe the first internal assessment যদি superior extremity পুরো পড়ানো হয়ে যায়। A course of the radial artery, course of the ulnar artery, আমার ফার্স্ট MBBS এ এসেছিল কোর্স অফ রেডিয়াল আর্টারি। ওইটার সঙ্গে পালস মাপার সময় কোনো ওই যে অ্যানাস্টোমোসিস সাইড সেখান থেকে যদি কোনো ব্যাক ফ্লো হয়, আমরা এখানে ওইটাই বলছি যে পুরো total obliteration. The physiological principle is total obliteration of blood flow during measuring middle finger, during rolling the middle finger and estimating the condition of the arterial wall, whether it is thickened or not. Maybe that is something to do, but I think at least if you tell from the physiology or medicine exam point of view, you don't have to utter those things. Basic things, basic knowledge, if it is correct conception, then it will be required. But don't go for uttering this ulnar artery and all during measurement of arterial pulse, radial pulse, right? All of you practice pulse, blood pressure both, and if you have done it, there are few more minutes you can practice general physical examination also.